Get Your Health Back series, Brad Leech is back, nutritionist and a leading researcher into leaky gut. And that's the topic I want to speak about today because it's prevalent. So how bad is it out there in regards to leaky gut?
It's pretty bad. Our previous research, we looked at a number of conditions with leaky gut, right? And now these conditions were autoimmune disease, inflammatory bowel disease, digestive health issues, metabolic related conditions. And we estimated that 1 in 3 individuals who have one of these chronic health conditions will have this leaky gut. So that's about a 30% prevalence rate in these individuals with this disease associated with leaky gut.
Is there a correlation between the leaky gut first and then the disease, or vice versa?
Listen, if I could research and understand and answer that question, I'd win a Nobel Prize. In the research community at the moment, that's the question we're trying to answer now. Which one comes first, the leaky gut or the disease? What I can tell you is without leaky gut, a number of autoimmune diseases wouldn't manifest. With leaky gut, the prevalence, the severity of these chronic autoimmune conditions would get worse.
So you're saying it's a pretty powerful underlying factor to disease?
Yes, let me clarify that. It's not a cause of disease, it's a contributing factor. Now, without this leaky gut picture, then disease may not manifest in, let's say, autoimmune conditions.
Okay, and the leaky gut is an inflammation characteristic in the gut?
Leaky gut involves the loss of integrity between the cells of the small intestine. So in our small intestines, there's only a single layer of cells that's preventing from where the food is into our blood, one single layer. And during leaky gut, these cells almost open up in response to chemical signaling from the environment. When that happens, that's leaky gut.
And the best way to approach that situation?
The first and foremost thing is to get tested. Unfortunately, based on what we know at the moment, it's highly essential to get a proper test to actually diagnose whether or not you have leaky gut, because there's limited research to state that treating leaky gut will have benefits unless you actually have this leaky gut.
But wouldn't you know yourself by the way you feel?
Unfortunately not. So some of our previous research has actually indicated that common symptoms of leaky gut that we thought, such as bloating, indigestion, reflux, are not actually associated with leaky gut. It's more so metabolic-like markers such as inflammation, high levels of fats and triglycerides and cholesterol within our body, which is actually the indicator that someone may actually have this leaky gut.
What you've just said there is you could have leaky gut without knowing it.
100%. That's why working with a practitioner is so essential to actually get that diagnosis to then go on to get treated.
There we go. Leaky gut. We know when something's going on, but how many people out there have got a situation going on that they don't even know, and then when the condition comes, then they find out they've got leaky gut. So, isn't it a wise thing to have a diet that's going to be less of a chance of getting a condition like that? I'm talking preventative. A diet that is healthy and no chemicals, just organic. And then we're not going to suffer the potential of having leaky gut. And I have to thank Brad because that was very exposing. And thank you for watching another one of Don's Get Your Health Back series.